everyone, welcome to our presentation about ACEs Aware in Ventura County. My name is Mika Kazmar. I'm a grant coordinator for ACEs Aware.
My name is Imani Kelly, and I am also a grant coordinator for ACEs Aware. Our role in this project is to work on the implementation side of the ACEs Aware screenings and trainings in the clinics of Ventura County, as well as providing supplemental provider training.
In this presentation, we'll be going over the introduction of ACEs as well as the science behind ACEs and what we're doing in Ventura County. So what is ACEs? ACEs is adverse childhood experiences and is a largely unrecognized factor in healthcare. Exposure to trauma in childhood can cause prolonged activation of the toxic stress response in the body. Children are more at risk for the negative outcomes of trauma since the brain is still developing. In a landmark case by Kaiser Permanente, there are 3 domains of ACEs: abuse, household dysfunction, and neglect. ACEs Aware in California is an initiative that aims to train Medi-Cal providers in identifying, diagnosing, and treating ACEs. In June of 2020, the Landon Pediatric Foundation was awarded funds to aid provider training in ACEs Aware. ACEs influences a majority of the population of California, with 62% of residents experiencing at least 1 ACEs in their lifetime and 16% experiencing 4 or more ACEs throughout their lifetime. ACEs also has associated health conditions for both pediatric and adult patients, including for pediatrics, asthma, allergies, dermatitis, and eczema, and for adults, cardiovascular disease, tachycardia, and stroke. So I'm going to turn to Imani to talk about ACEs Aware in Ventura County.
The Landon Pediatric Foundation was awarded a state grant by the ACEs Aware Initiative for provider supplemental training. Our team is working to train providers and staff about the science of ACEs and how it fits into our clinics. The primary objectives of the Ventura County ACEs Aware Initiative are to target family practice and pediatric clinics. Our main goals are to have every provider complete the ACEs Aware training and a test in order to screen and bill for the screenings. We also aim to train staff on trauma-informed care, resilience, and sensitivity. Our third goal is to create an MOC curriculum of enduring educational material for providers to participate in for CME and MOC credits. Our fourth goal is to collaborate with local agencies and the other Ventura County grantee to create a care network and website with provider and family resources for referrals. Our fifth goal is to understand the importance of screening and treating eligible patients for ACEs. There are 3 steps to becoming ACEs Aware in Ventura County. The first step is that providers must complete a 2-hour online training. This training is available on the state ACEs Aware website. It can be completed in sections, and you will earn 2 MOC and CME credits. The second step is that providers must attest to completing the training before being able to bill for the screens. The third step is that providers can be able to start screening and referring to external resources for outside care to improve overall patient care by utilizing the ACEs Aware Ventura County website. Now we'd like to explain the benefits of screening for ACEs in your clinic. On the clinical side, we aim to improve patient care. By improving patient care, we will be able to have a recognition of ACEs and referrals to local resources that address a broad spectrum of needs. We also will have preventative measures against negative long-term health outcomes. Financially, ACEs Aware will pay Medi-Cal providers for screenings. Each screen is $29. You can screen adult patients once a lifetime and pediatric patients once per year. All Medi-Cal providers are eligible for this payment. Operationally, we plan to implement screeners into Cerner, pilot at local clinics, train providers and staff, and have an easy-to-navigate website for ACEs Aware in Ventura County and resources.
At ACEs Aware Ventura County, we understand that providers and staff are busy, so we created a 3-tiered incentive program to encourage providers to engage with the training materials. The first tier is to complete feedback surveys. We ask that all providers fill out a brief 1-minute feedback survey so we can accurately gauge clinical attitudes towards ACEs Aware. Once filling out the survey, providers will receive an ACEs Aware Ventura County pen and stickers. The stickers can be placed easily on the back of IDs and contain material about billing information. The second tier is training and attestation. ACEs Aware Ventura County will award face masks with ACEs Aware logos to providers that complete the online training and attest to their certification. The third tier is when clinics complete the training. If Medi-Cal providers in the clinic complete training and add tests to the training, then we will send pizza or another COVID-friendly prize for your clinic to enjoy. The following are some helpful links for providers and staff who are interested in ACEs Aware, including the ACEs Aware training, provider attestation provided by Medi-Cal. If you have any questions, feel free to email us at acesaware@ventura.org or visit our website at acesawareventura.county.org. Thank you for joining our presentation.
Let's bring better help, better health, and better hope to Ventura County.